what are your thoughts on more of the cosmetic, not obese patient being on the Ozempic? Is that something you guys are dabbling with? Is that
Well,
ethical?
yes, no, happy to discuss that. So the first year that we were offering these medications, we knew that pancreatitis was a risk, but how much of is it really a risk, on the street? How much is that a real thing? And so for the first year, we were very strict about BMI parameters, greater than 27 with obesity related conditions or greater than 30. And we were sticking to those BMI parameters. But after a year and treating around 1,000 patients, people were not getting those most serious side effects. Thank God. They were getting nausea and constipation, and I can prescribe Zofran with the best of them. And so we were definitely treating those mild side effects. But what we found over the course of the year, the side effects on average were mild, treatable, and time limited. They went away on their own eventually. But people were not getting pancreatitis. We even had two patients went to urgent care because they were having abdominal pain. We were like, oh my God, is this pancreatitis? Come to find out, it was purely 100% dehydration. And so that's one thing that we found that most people don't really seem to think about or talk about, is that because these medications suppress your appetite, you're eating less, but you're also drinking less. So I think the serious side effects are coming from dehydration. So after that year, realized that people were not having the most serious side effects. Now we absolutely will prescribe to patients, even if their BMI doesn't meet that parameter. Also keep in mind that we're talking about compounded versions of these medications, which insurance was never going to cover. And that's, I know things are different with the Canadian health system, but at least in the US, to have a chance of it getting covered by insurance, you would need to meet those BMI parameters. But even then, it's statistically unlikely in America that insurance is going to cover it, or they'll say they cover it, but the copay is like $1,000, and basically just the same amount as paying out of pocket for the name brand. BMI became less of an issue. One, because we weren't dealing with insurance, and then the other thing was that we saw people were still doing fine, even if they did. When they're taking these medications. So we don't stick to that BMI parameter anymore. Now, if they're coming to us to lose weight before their wedding, yes, we'll prescribe them the medication. We're just not getting into that judgmental aspect of it. I mean, if somebody comes in and they have an eating disorder, like if they're overeating kind of a disorder, then yes, we'll prescribe the medication to them. But if they're anorexic and want it and think that, and they have body dysmorphic disorder where they think they're not thin enough, no, we won't prescribe it in that case.